break down the brand new global standards they use to figure out what it all means.
You know that feeling, right? That little bit of panic, maybe a tightness in your chest, where you just wonder, is this normal? It's a question we've all asked ourselves. But how does a doctor take that feeling, that subjective experience, and turn it into a concrete medical fact? How do they really know if your lungs are working the way they should be? Well, to get to the bottom of that, we first have to figure out what normal breathing even looks like from a doctor's point of view. And that means moving beyond just feelings and stepping into the world of hard data.
At the end of the day, your doctor can't just go by how you feel. They need numbers. They need objective, clear measurements. A real snapshot of your lung capacity and efficiency. That's the only way they can properly diagnose what's going on. And that is exactly where specialized testing comes into play.
So how in the world do you turn something as basic as a breath into cold, hard data? Well, doctors have a pretty powerful set of tools designed for that exact purpose.
They're called Pulmonary Function tests, or PFTs for short. And you know, despite the technical-sounding name, the idea behind them is actually really simple. These are just straightforward, totally non-invasive tests that measure two basic things. First, your lung capacity, that's how much air your lungs can actually hold, and second, your airflow, which is all about how quickly you can move that air in and out.
And get this, it's not just one single test. PFTs are more like a whole suite of measurements working together. Spirometry is probably the one you've heard of. It's all about how much and how fast you can breathe out. Then you've got lung volume tests, which, yep, you guessed it, measure your total capacity. And finally, there are gas transfer tests, which look at that absolutely crucial final step. How well is oxygen actually getting from your lungs into your bloodstream? Altogether, they give doctors this incredibly detailed picture of your lung health.
Okay, but you know, just getting the numbers, that's only half the battle. Interpreting them correctly, that's what really matters. And for that to happen, doctors all over the world need to be on the same page, kind of like they're all using the same rulebook.
So for years, clinicians were working off guidelines that came out way back in 2005. But then, in 2022, a joint task force from the European Respiratory Society and the American Thoracic Society published a massive update. And trust me, this was a huge deal in respiratory medicine. This wasn't just some minor tweak, it was a complete overhaul, bringing in nearly 2 decades of new science and a much better understanding of how lungs work across all kinds of different people around the globe.
So why does any of this matter to you? Well, because a global standard means that whether you get your test done in Tokyo, Toronto, or Tallahassee, the doctor looking at your results is using the exact same rigorous, up-to-date science to interpret them. It just means better, more consistent care for everyone, everywhere.
All right, so we've got the tests and we've got the brand new rulebook. Now for the really interesting part. How does a doctor actually use this rulebook to decode your results and figure out what's going on with your lungs?
So the very first thing that happens is your numbers get compared to what's expected for a healthy person who's the same age, height, and sex as you are. Think of it like a police lineup, but for lungs. They're essentially putting your results into that lineup to see if they fall within the normal, expected range for someone with your exact profile.
These 2022 guidelines lay out a super clear, systematic 5-step approach. Step 1, compare your results to that reference group. Step 2, look for a pattern. Is there a specific kind of problem showing up? Step 3, figure out how severe it is. 4, if they gave you a medication to open up your airways, that's called a bronchodilator, did it actually help your numbers? And finally, step 5, track any changes over time. This whole process turns a bunch of raw numbers into a living story about your lung health.
Now, when doctors are looking for a pattern, they're often hunting for one of 2 main culprits. The first is an obstructive pattern. This basically means there's a bottleneck somewhere you have trouble getting air out quickly. The other is a restrictive pattern, which is kind of the opposite problem. Your lungs can't fully expand to take in a normal amount of air. Figuring out which of these patterns is happening, if any, is a huge step in making a diagnosis.
So this 5-step process gives doctors this incredible, data-driven framework. But, and this is a big but, it's absolutely critical to remember that the numbers on a piece of paper never ever tell the whole story. You know what? The guidelines themselves say it perfectly right there in the conclusion. They state that interpreting these tests has to be complemented with clinical expertise and, just as importantly, consideration of the individual. The tests are a tool, not the final word.
So think of it this way. A PFT result is a vital piece of the puzzle, a massive clue for sure, but it's not the final diagnosis. Your doctor takes these test results and combines them with your personal medical history, with a physical exam, with everything else they know about you, to see the complete picture. The real art of medicine is putting all of those pieces together.
So, the next time you think about your breathing, just remember, it's so much more than just air going in and out. It's data. It's a story about your health, just waiting